Hey team, this is Ashley, the clinical nurse manager with Synergy. Just wanted to go over a quick little recap with our assistive devices that you have seen in SIM, also in the homes of many of our clients. Please remember that the assistive devices, especially if you're having a cane being used, we would always ambulate or walk with that weaker side first, and we would hold this on the weaker side. Again, as we talked about in SIM, sometimes it's preference for the client, and that's okay. You will see the 4-point cane or the single point cane. Either way, the mechanism works the same. If you have a client with a walker, whether it is a freestanding walker like this one or one that has wheels on it, the most important thing is always making sure that this is locked in place. So there'll usually be buttons or levers right here to kind of press on to open or close, and then you want to make sure you really hear that click, and please try to bend it back in to make sure that it's locked in place before allowing the client to use it. Of course, they would go with their weaker leg first, the same as the cane. You can also use this to help them stand when getting them out of the wheelchair, when doing incontinence care, when dressing them. Anything like that, they can use this if they are able to bear weight. And lastly, of course, we have your wheelchair. Whenever you are using the wheelchair, again, the most important piece is making sure that those wheels are locked. You may see locks up on the handles, they may be on the sides. A lot of times they're going to be down here where the client can actually lock them in place. With this one, it's going to be right here. So the first step is to always lock it in place. The second step is going to be to make sure that you move these pedals. If their wheelchair has these, some do, some don't. A lot of times they are removable, as you will see on this one. They are also adjustable. If they do have the pedals and you're getting them out of the chair, of course we want to move those out of the place. And there's usually levers down here that you can just open them up and slide them to the side. Make sure they're completely back. And at this time, it's safe to get the client up. But beforehand, please kind of push on that wheelchair. Make sure those wheels are locked. And then at that point, you are able to take your walker, if they have this system in place, and you can help them stand up and bear weight. And there you are free to change them, do incontinence care, anything else you may need. And it'll be the same situation when getting them back into the wheelchair. We want to make sure those wheels are still locked, and then you can click these pedals back into place. And once you know that they are safe, everything's locked in place, you can release that brake and you are good to go.